Hey everybody, it's Cindy Matalucci, your host of The Pulse and Live with Cindy. I hope you guys had a fabulous Valentine's Day and spent some time with your loved ones or your significant others. I know we were dealing with rain. We're not used to that in San Diego. We're so picky about our weather here. We're very blessed though. I know we need the rain, I just wish it wasn't so intense. So hopefully you were safe, you had a great time. Today is Friday the 15th of February. We have a great show lined up for you today. Again, if you have something that you want to get out there to our viewers, if you have an event that you're hosting, or you want to get more exposure for your brand, or you just have a story that you want to share, please reach out to us at thepulsesd.com. Hit us up on social media at thepulsesd. We would love to have you as a guest on the show. We're all about elevating your brand for 2019, so we want to help you do that. So we look forward to hearing from you. And I have to do a shout out today to Black Halo for my dress today. Thank you so much. I'm feeling the leopard. I love the leopard. They sent this to me, so thank you so much, Black Halo, for my dress today. And then before we get started, I want to thank our sponsor for the show today. As you guys know, it's all about being your best self in 2019. So I am doing my spin challenge, which is, it was gonna be 30 days, but then I lucked out. February was 28 days. So it's a 28-day spin challenge. I'm trying to do at least 4 times a week or at least 16 of the 28 days. I'm on day 6, so I'm a little behind the 8 ball. But I'm spinning this weekend, so if you guys would like to spin with me Saturdays and Sundays at 10:45, it's at Edge Cycle. They are down in East Village. They're fabulous. Janaea is the owner. She was at Soul Cycle for 6 years and then opened Edge just recently. They've only been open for a few months, but they're fabulous. The energy in the class is great. It's a wonderful workout. So I want to thank them again. Edge Cycle, and you can get the information on our website. And please come to a class with me. Join me for a class. I usually post on social media what classes I'm going to be taking, and then you can come see this fabulous place, check it out, be my guest, and support my spin challenge. Hashtag spin with Cindy. Okay. So thanks to Edge. So now, without further ado, you guys, I want to get started on a fabulous show. I have got great guests today, Dr. Trent Douglas and Dr. Katerina Gallus from Restore Plastic Surgery.
Hello, Cindy.
Thanks for having us.
We're so excited to have you guys on the show. I've actually been to their facility. It's gorgeous.
Thanks.
Cannot wait to showcase a little bit about what you guys do. We're also going to have a great topic today. We're going to get into some issues with breast implants and things that can happen. But before we get into that, I want to talk about your story, because you guys, you're very different. I mean, you have a partnership, and you guys became colleagues like 20 years ago.
We were both in the Navy, and our careers have really paralleled each other. So we've been working as colleagues since the late 90s. So as our careers in the Navy wound down, it was a natural next step to start a practice together.
Well, I love that. And you guys, I mean, you did reconstructive surgery in the military and war casualties and things like that.
Yes.
And then you also were deployed Operation Enduring Freedom in Afghanistan. So, I mean, talk to us a little bit about that and then making the transition.
Sure. So we both deployed to Afghanistan. I was at a forward operating base, so pretty far forward, with a small surgical team that handled incoming casualties from where we were, and saw a lot of trauma, and then came back from my deployment to take care of those same trauma patients as they are further along the pathway to recovery. It's a great experience to take care of our nation's soldiers. It's so rewarding, and we did that for 12 years in the Navy.
Wow. So, but you guys have had 30 years of experience doing what you're doing.
Yes.
Yes. So between our combined experiences, our training, our years in the military, we're very accustomed to all forms of both reconstructive and aesthetic surgery.
Well, and I want to talk a little bit about your specialties and what sets you guys apart. Obviously cosmetic, reconstructive, but you guys have some state-of-the-art equipment like the Vectra 3D system, which I've seen. So tell us a little bit about what sets you guys apart.
Well, to speak to the Vectra, it's a 3D camera. It has 6 different cameras in it, and then it can take a picture of you front and back and then stitch it all together to create a 3D reconstruction of you. And then up on that, we can then simulate different body changes, augmentation, reduction, liposuction, things like that, so that you can see kind of any asymmetry differences from side to side that you have already and how we can address that. and you can see what your results will look like on you, not just, before and after pictures of somebody that might or might not look like you.
And that's so important, I feel like, being able to see that, right?
I think so, because as people go through and are looking for a plastic surgery practice or for surgeons, they look at a lot of before and after gallery pictures, which are not always you. So using the Vector 3D imaging system, it lets us simulate results on your actual body.
Exactly, and then what size implant to get, right? Because that's a big thing too. What's it going to look like?
Well, one of the more confusing things is cup size. And I remember way back, I was like, I'm just going to be the full C MD, because everyone wants to be a full C, whatever that is. And so the women who are larger and want reductions want to be a full C. And a lot of times the women who are smaller and want augmentation want a full C. But really defining that, I mean, it varies from Victoria's Secrets to your Nordstrom bra. I mean, that's not a defined entity. So having that photo opportunity to say, okay, this is what this size implant looks like, and they're like, oh, no, or bigger or smaller, or those sorts of things really help. It helps for good communication and to manage expectations.
And I think some of the other technology that you mentioned, we do have 2 laser platforms. So we have a fractionated carbon dioxide laser that we use for resurfacing of face, neck, chest, as well as a specialized piece for doing the back of the hands, which is becoming ever more important for
those
hand rejuvenation. We also have the IPL machine and erbium laser for resurfacing, and the photofacial with the IPL. So it can treat multiple different skin types in the office. And probably one of our more popular treatments is the Dermal Infusion machine.
Okay, I was going to ask you what was popular.
Yes, I'll let Dr. Gallus tell a little bit more about that.
The Dermal Infusion machine is fantastic. So it's a microdermabrasion. It exfoliates, so it has a suction on it, and then it's microdermabrating and then infusing hydration at the same time. And then we can adjust the serum that's infused. So vitamin C or skin brightening, salicylic acid if you're acne prone, those sorts of things. And can just adjust the microdermabrasion aspect of it, depending on your skin type. It's fabulous. If I could do it every day, I would, in lieu of washing my face, but that's not really practical.
Right. It's a great treat right before an event, a day or so before. If you've got to be red carpet ready for any events, it's a great treatment.
Hint. Maybe we'll do that on camera, right? There's parties coming up on the 24th, so you got to get in there. So the other thing I was going to say is you guys are certified American Board of Plastic Surgery, right?
Yes.
Which is very important. And then you guys won some amazing awards recently. My Face, My Body Awards won, what, Best New Practice?
Yeah, so for 2018, New Practice of the Year, and also, and our architect was very glad to see this one, Best Practice Design.
That's right, because if you see their place, and we're actually running some video footage of their place, it's really great. The colors, the mosaic, like everything that you guys used in there. So congratulations.
Thank you so much.
On your awards. This is amazing. And then before we get into our topic today, I want to talk about your vision and sort of what you want your patients to expect, or what they can expect when they come in to see you.
Sure. So we like to take the time it takes to sit and talk to somebody about what their goals are, and listen to the patient, and then come up with a plan. So very collaborative. Our team there is very friendly. We're very communicative, and so if you have more questions, come back in and we can discuss it. So that's sort of our goal, is to not have the patient feel rushed.
I love that. And making the informed decisions.
Yes.
And I saw that. I saw the testimonials on your page too. People were really appreciative of that with you guys. That stands out on your website.
And I think what we've tried to achieve is really a boutique approach where we spend the time necessary with the people to get them comfortable with the procedures, because you are doing something to change your appearance or reconstruct something. So you do need to feel comfortable with your board certified surgeons, as well as have the education and the commitment that our team is there to take care of you from start to finish.
I love that. Okay, so now you guys have to go see these guys. We have them on the website. We'll have all their information, where to find them. But we're going to dive into a topic today. It's been making quite a bit of headlines in the news lately. Social media influencers, they've been sharing their stories about breast implant illness. And that's definitely an area that, we can't really get into because there's just too much going on in that industry. But what we want to do today is we want to talk about something that we can really be a resource to you on, which is BIA-ALCL, breast implant associated anaplastic large cell lymphoma. We want to bring this topic to the table and get some education out there to our viewers on this. And so obviously the doctors have been so gracious to come on and talk a little bit about this with, what we can do, what to look out for. So to get the conversation started, I guess maybe you guys could educate people on what it is, the illness itself.
Sure. So BIA-ALCL, breast implant-associated anaplastic large cell lymphoma, is a lymphoproliferative disorder that can be transmitted into being a lymphoma. There are some diagnostic tests that help, as well as some imaging studies that can help see if there's fluid there. If left untreated, it can cause some localized tissue infiltration as well as move into the lymph nodes. When it's caught and addressed early, treatment is curative.
So what's important about it is it's associated with breast implants. Mm-hmm. It presents usually on average 8 to 10 years after having implants placed as a fluid collection or a mass. And the important thing to note is that that fluid collection has to be tested for cytokines CD30. So runs through some tests to see if it's just a benign fluid collection or something that needs to be treated. And if caught early and the index of suspicion is high, then it's curative.
Yeah, and I think it's important too to listen to your body too. If you're not feeling well or something's going on, you have to, know your body. I've dealt with inflammation and issues myself, not this issue, but you really have to second guess. You have to go to doctors. You have to make sure that you're in tune with your body and that you are getting checked out. But what I thought was interesting is we were looking at some of the stats and talking about this, but there's been 17 confirmed deaths globally of BIA, but only 9 in the United States.
And that's over a 20-year period too. Okay,
and that was 20 years ago, right? And I think that there are some symptoms of it, which you were talking about, which is fluid, right? So that's the main thing as far as symptoms go. And then what is the risk of developing it? It's pretty small.
It's small, so it's 1 in 3,800 to 1 in 30,000. It's being studied right now globally, so that's a very big range. But percentage-wise, it's 0.02% to 1 in 30,000, which is very, very small. And just for a reference point, breast cancer is 12%, so a 1 in 12 chance over a lifetime that you'll develop breast cancer, a 1 in 3,800 chance that you might develop this disease if you have implants in place.
Well, and can we talk about the difference between the implant texture and what role that plays in it? Because I know that people said, originally I think it was diagnosed because somebody had a textured implant.
Correct.
But that's been changed and there's been a lot of information that's been updated. But will you shine some light on that aspect?
Sure. So the textured surface of an implant, there are variations of how textured that is. So that's where some of the variability and the numbers that we just talked about were. So more aggressive texturing leads to a higher chance of having ALCL. Lower aggressive texturing gives you the 1 in 30,000. The more aggressive texturing, more the 1 in 3,800.
Wow.
So there are lots of things. This is a very evolving topic, and updates were made to the FDA website as recently as February 6th. So traditionally, there has been only association with textured implants. Mm-hmm. Recently, there have been some reports of associations with smooth implants as well. There are multiple reporting avenues for this. So what has happened is there's still not a proven 100% case with a smooth implant. Everything they found with smooth has been a mixed implant.
So it's somebody who had maybe smooth implants but had a prior history of textured implants. So far there's been no isolated smooth implant only associated case.
Okay.
But in trying to be conservative, the FDA is, making sure that people are cautious about any kind of fluid collection with a breast implant.
So maybe, because I always thought of like saline and silicone, right? Mm-hmm. I never thought about texture or smooth. Right. And I don't know if other people do. I mean, is it a problem with saline or silicone?
No, and that's a great question because there are roughly equal numbers of saline and silicone. It does have to do with the texturing.
Okay.
And so from the texturing, there are 4 things that have been associated with the BIA-ALCL. So there's a yet to be determined genetic component.
Okay.
There seem to be fewer cases among Asian patients than other demographics. time, bacterial contamination, which is thought to jump onto the texturing, and over a long period of time, that bacterial contamination can lead to the generation of the ALCL.
Wow.
And so because of that, it varies from country to country because there's different techniques used for augmentation. In the United States, I think often we're overly sterile about everything, and so that helps. And so there's other countries where the rate is higher because maybe their technique hasn't evolved as much. And then textured implants as a whole are a small proportion in the United States of the type of implants we put in.
Okay.
Overwhelmingly, people have smooth implants. But in other countries, texturing is popular, and then there's different types of texturing that's not even available in the United States, not FDA approved. And that's a problem in Europe. But we're looking at this as a whole group.
Right. And I think some of the numbers too, there are 457 confirmed cases, and there's over 2 million women who have had breast implants placed. So to put a little perspective on the numbers, yes, it is absolutely a thing. It is being studied. There's a profile study as well as some initiatives by the American Society of Plastic Surgeons and the American Society for Aesthetic Plastic Surgery. It is being actively studied and is a hot topic.
I love that. Well, and I guess the question is, to educate everybody, what do you recommend when people are going to get implants? They should go to a board certified, right?
Well, sure. And I think one of the reasons that the FDA put the statement out to everyone is that OBGYNs, depending on your state, people who are not surgeons, dermatologists, can put breast implants in, and maybe they're putting them in, but the person who was most likely to see somebody with an implant complication was a plastic surgeon.
Yes.
Then we realized, well, maybe you do go to your regular OBGYN or your family practice doctor, and we don't want them to ignore fluid around an implant. That's not normal. So making everyone aware, not trying to create panic, but just making everyone aware, because we don't even put in all the implants so that everyone's informed about what to do and how to treat it, because if caught early, it's completely treatable.
And then you guys can do that. You can remove those implants.
Yes.
Right. And I think that's what we're seeing in the office a little bit over the last month or so, is more people coming in saying, I'm interested in removing my implants, what are my options? So current treatment and options for people just trying to do this electively, because for some people it is peace of mind if they want to address that health concern. And so taking the implant out, you can take the implant out permanently and leave it out. You can take the implant out plus the surrounding scar tissue capsule, or you can take the implant out with or without the capsule and exchange it for a smooth implant.
Oh, wow. So there's options.
There's options, and some women, over time, gravity gets all of us, and sometimes with breastfeeding or the natural aging process, a breast lift might be in order.
Well, and I was going to say too, it's also time, right? Because everything over time, if you have implants for 25 years, something could happen, right? Something can rupture.
Right.
I mean, so it's also kind of being...
They're not lifetime devices.
Okay, so I think that's important too, right? To know.
Right, the average lifespan of an implant is about 13 to 14 years. It's important to know that when you make the decision to get an implant, you will need additional surgery at some point during your life related to that implant, whether that's implant rupture, treatment of capsular contracture, exchanging the implant out for different sizes, or even adding a breast lift.
Well, and we have some really good resources, and we're going to be posting this on the website. There's detailed information, which is at the ASAPS website, surgery.org/professionals. There's information on there which you guys provided. They've provided a list of great places for you to go. I think there was a surgery.org media resources, and then Mollenkopf Aesthetic Breast Reconstruction Fund. I think that's something that's helping patients that don't have insurance, I believe, right?
Correct.
Coming up with funds and things like that to help with this disease, and we'll have all that information. But we're just happy that you guys are here being a resource on this.
Oh, it's our pleasure. I think that's one of our things in giving back, is to educate the patients, and we always want people to have the information to make the right decisions.
Yep.
I love that. And then I just wanted to ask, because I know you both have kids, so before we go today, I just wanted to ask sort of how you guys balance everything. Because, I mean, you're running a practice. We were just talking about the stuff that's going on the weekends. Do you have any tips to the viewers on how you balance everything?
I think I'm always trying to maintain a balance. I have 3 daughters, and from 7 to 12. So you get into that push-pull of I'm at work, I feel like I should be at home. I'm at home, I feel like I should be at work. And so trying to separate that, like when I'm home, being present at home, and when I'm at work, being present at work. And then rolling with the punches. This morning, I rolled in this morning to the office with 2 out of my 3 daughters because they're off for school, and they just sit in my office and color and wait for somebody to come pick them up. But most of the time, it works out.
Yeah, I've got a 14-year-old son, 12-year-old daughter. One's a dancer, and my son's a soccer player. So we're constantly going in different directions, soccer tournaments, dance competitions. So it's living in the moment and enjoying things, watching the kids grow and enjoy their activities as they become young adults. And my wife and I get to sit and be along for the ride on watching some pretty amazing kids.
I love that. Well, thank you guys so much. So I just want to mention that we have their website up. So it's restoreplasticsurgery.com. Make sure you go to their Restore SD Plastic Surgery Facebook page, comment with RSD to get 15% off their fees for a breast lift, which is amazing. So they're offering that for our viewers. So again, go to their Facebook page. It's Restore SD. Like it, comment RSD for 15% off, and that expires March 31st. So we'll have that information. Follow these guys on social media, everything that they're doing. And then tell everybody where you're located in La Jolla.
So we're right off Nobel Drive, 8899 University Center Lane, Suite 200. It's the big curved front building that if you're driving 5 South and La Jolla Village Drive, you can look to the left and see it. It's got the big flag on top.
And the best way to contact you would be through your site for like a consult or?
Go to the website, restoresdplasticsurgery.com, and you can fill out an information form there.
Perfect. Well, thank you guys so much. Thanks for being on the show. We really appreciate it.
Thanks, Cindy. It's a great opportunity to be with you.
Thanks.
And we'll be showing you some more from them too. Hopefully they'll come back and show us some new things that they're doing. But you guys, I hope you have a great day. Again, we'll have all this information on the website. Thanks so much for tuning in today, and we'll see you next time when we put our finger on the pulse of San Diego. Bye, guys. Happy Friday.